Greetings, I'm Guillermo Bernal, professor of psychology, now retired from the University of Puerto Rico. I'll be covering some key points from our paper, Can CBT be Optimized with Parent Psychoeducation, a randomized effectiveness trial with Major Depressive Disorders in Puerto Rico. The article is on the effectiveness of an RCT with severely depressed Puerto Rican adolescents to determine if CBT could be augmented with psychoeducation. The article may be useful to colleagues that are in the field of family therapy in practice or in the field of family science in research. The article exemplifies how it is possible to bring together an individual therapy, such as CBT, with family systems. The article exemplifies how it is possible to bring together an individual therapy such as CBT with a family systems approach that incorporates family education. The paper follows Jay Lebo's notion of a quiet revolution that has moved the field of family therapy towards an integrative practice of family, couple, and individual therapy. We follow this movement of integration by incorporating parents from the moment that we do the screening, the initial interviews with adolescents, and later with parents in psychoeducation while the adolescents are in their CBT sessions. The inclusion of parents in whatever form is generally helpful from a systems perspective. Psychoeducation is generally a non-threatening way of engaging and incorporating parents in the therapy of their children. The article can be also helpful to folks in the field of family science. The formal inclusion of culture, language, context are distinguishing features of the article. Prior to this RCT effectiveness trial, we conducted pilot efficacy studies on CBT with Puerto Rican adolescents using a protocol developed by Ricardo Munoz and colleagues based on Pete Lewinson's and colleagues' Control Your Depression book. When we pilot tested the original CBT with adolescents in Puerto Rico, much of the language had to be changed, and it became clear that cultural adaptations needed to be made to the protocol. This moved us to develop the ecological validity framework with which to culturally adapt evidence-based treatments to be more attuned to the cultural context language of adolescents. 2 small RCTs were conducted in preparation for the larger trial published in Family Process. The article may be also helpful to individuals in the field of family science. The study contributes to family psychology and family science in several ways. First, our research question was whether or not psychoeducation could augment CBT. As such, we constructed an augmentation design to test this hypothesis. Second, the instrumentation of this study was carefully selected, and years of work was invested in ensuring that the instruments were properly translated and had the adequate psychometric properties. We conducted reliability and validity indices of the instruments. Also, we were able to carry out analysis of the measurement model of the key outcome measures and examine whether or not the theoretical structure of the instrument could be confirmed by means of confirmatory factor analysis with Puerto Rican samples. The consideration of language, culture, and worldview is at the root of adapting EBTs such that these treatments can be accepted and effectively used with diverse populations. We conducted 12-month follow-ups of the samples showing that culturally adapted CBT for depression was effective and with a highly symptomatic sample with multiple clinical diagnoses. However, the augmentation hypothesis was not supported, probably due to the sample size. I want to thank you for joining us in this new space by Family Process in Wiley, and should you need to get in touch with me, you can reach me at guillermobernal@icloud.com. Thank you for joining us.